Back to Ozarks tonight. The Community Foundation of the Ozarks recently awarded $40,000 in grants to 5 different organizations in Greene County working towards mental health programs for senior citizens. To talk to us about the need for these grants and these services, we have joining us today Bridget Dierks from CFO and Alex Cobb with SeniorAge. Thank you all so much for being here.
Thank you.
And Alex, SeniorAge is one of the recipients for this grant and 4 other organizations, and we'll talk a little bit about them first. I wanted to start with you, Bridget, with CFO. This is the first year for this type of grant. Why this year, and how did CFO see the need for something like this?
Well, CFO has been very focused recently on issues of health with regard to our grant making, and we had been working with the Springfield-Greene County Health Department to work on the Canary Measure, which is a program that they have undertaken in order to measure health outcomes here in Greene County. And one of the areas that we really saw as a significant need were issues related to senior mental health and issues of isolation amongst seniors here in Springfield. We have a higher than average number of senior citizens who live alone, which causes major issues of isolation and disconnects them from the community. So we were looking to be able to try to impact that.
SeniorAge, Alex, I want to talk about that. You're one of the recipients. You received $10,000 through this grant for programs for mental health for seniors. How do you plan on using this money? How will it help programs you have already been working on, or maybe something new?
Sure. We operate 36 community centers for seniors. Here in Greene County, we operate 6. And the senior centers address one of the big issues that was mentioned by Bridget, the issue of isolation. So our centers serve as a magnet. They draw in a lot of people who have lost a spouse through a variety of ways. But that center becomes then a hub of their community, their relationship network. And then each of those centers operates as a hub of service into the surrounding community. For every meal that we serve in one of our centers, we're delivering into the community to people who can't come to the center. So every day we're dealing with people and working with individuals who need additional assistance, need additional help. And one of the areas that we've also identified is the area of mental health. 20% of everyone over the age of 55 has an identified mental health issue. We serve more than 10,000 seniors, so that's 2,000 seniors that just in our area of service. What we plan to do with this is identify 25 to 50 likely individuals who would benefit from some counseling, and we're going to be able to allow them to make appointments, go to 4 or 5 sessions with our community partners that way, and the Ozarks Community Counseling Center and New Leaf Counseling Center, and be able to address issues that are common to seniors: anxiety, depression, isolation, grief, and things of that sort.
That's very interesting, because when we talk about mental health, we normally focus on youth mental health, maybe adults, because you're juggling so many things. But I think it's a new concept maybe to a lot of people, that seniors are also dealing with anxiety, depression, and other things, and that might need counseling. Is that something you have found as you research more this topic, or talk to other community members about this topic?
It's common for seniors to struggle with those issues. What is less common is for them to admit those struggles and be willing to look for help and assistance. And also for seniors, one of the big struggles is the financial component of it. A lot of the people that we serve are at or below the poverty level, and they're making decisions between choosing food and medication. There's no funds left over to assist them with any kind of mental health issues and the types of things that counseling can assist. And so we know that the need is there, and the grant that's being provided is really going to allow us to help some of these people that we can identify to receive some much needed help.
Yeah, I think there's a real challenge amongst the senior citizen population in that they were connected via their jobs and their families. They're very, very well connected in their community, and then those connections cease to exist, and that isolation becomes so inherent and such a component of their lives that it sort of sneaks up on them a little bit. And I think that that's happening quite a bit here in Springfield, particularly because we need to be better connected with them in the nonprofit sector as well. We are very focused on youth issues here in Springfield, which is wonderful, but we also need to remember that our population has a significant number of senior citizens who need our help.
How can we become more involved and invite them? You know, you mentioned maybe organizations and volunteer opportunities, but as a community and maybe even as family members, how do we make sure that our seniors are not isolated and that we are talking about these things and making sure that they have what they need?
I can cover a couple of things.
Sure.
And then you want to cover something?
Sure.
We come from different perspectives, I think, on this a little bit. So some of our other grant recipients, for example, the Springfield Greene County Library is doing great work with individuals who have Alzheimer's and who have caretakers who are experiencing all the challenges of being a caretaker of someone who has Alzheimer's. They've got some great programming going on that we were able to partially fund with this grant program, and they'll continue that through the summer and into the fall. We've seen quite a bit of counseling related things, which Alex has mentioned. We've also seen some opportunities that have to do with volunteerism. As we said, Give 5 is a great example where we're connecting seniors. You know, there are also other programs throughout the community, not necessarily through this grant program, but, you know, RSVP through the Council of Churches is another good example of connecting seniors who have great skills and relevant information to offer the community in relevant time, that they just need to be well connected.
And what I would say is we benefit from the Give 5 program as well, and all the volunteers that we've drawn from that program. But a lot of what we do contributes to positive mental health for the seniors we serve. Like I said, the senior centers, they're a place where people go. That is their community. Our people that deliver meals into the home, our people who call people who are isolated at home, that is their relationship. And you ask what you can do or what volunteers here in Springfield can do, we can plug them in to things where they can call seniors, they can deliver those meals and establish those relationships. And a lot of the people here in Springfield, they already have those relationships with seniors. They live next door to seniors. They go to church or other places with seniors. They can be checking in on those people who have so much value and worth.
I don't want to go away before we mention the other recipients too of this grant. We have the Library Foundation, Lost and Found Grief Center, NAMI as well, SeniorAge, and then United Way of the Ozarks with the Give 5 program. Thank you for being here.
Thank you.
Continue doing the great work you do in this community.
Thanks.
We'll be right back with more.